Welcome to another episode of Provider Solution Blueprint on the Healthcare Soundbites. As a consumer, a customer, and a patient, I feel healthcare is expensive. I pay high premiums to maintain a decent insurance. Yet, providers say it's hard to retain talent, unable to pay big bucks to the healthcare professionals. Healthcare is not a place to get rich, it's a place to serve. The biggest question I had is, where does the money go when I'm paying such high premiums? The premiums we pay goes towards, firstly, the buildings. In America, people want to go to beautiful places. Providers spend a ton of money on good infrastructure. And secondly, on equipments. To bring the latest technology to the patients, they reinvest in the latest technology. Thirdly, on medical and pharma supplies like masks, sanitizers, gloves, gowns, etc. You'll be surprised to know how much money goes into it. And fourthly, maintain a strong legal team. People sue hospitals. There are too many regulations in the United States to comply to. Fifthly, the insurance company also makes it difficult to pay them. Lastly, hospital spends on charity. Not everyone can afford the healthcare. Please comment and let me know if our money is spent rightly or if it should be spent in a different way. Don't forget to subscribe and like or dislike. Thanks for watching.